Hi, let's see the next question. A 52-year-old woman is admitted in the hospital. Her hemoglobin is 6.8. So, because of a GI bleed, her hemoglobin is significantly dropped and she is getting blood transfusion, that is 100 ml per hour. And after starting the blood transfusion, 15 minutes later, she started developing a reaction. Okay, so she is having shortness of breath and she is experiencing lumbar pain rated 8 over 10, and she is feeling chilled. So what the nurse has to do? Blood transfusion reaction, hemolytic reaction. So the first option is obtain vital signs and notify the physician of potential reaction. Second option is slow the infusion to 75 ml per hour and reassess in 15 minutes. Third option is stop the infusion and run normal saline to keep the vein open. Fourth option is administer PRN pain medication as ordered. Apply oxygen at 2 liters per minute and provide additional blanket. So let's see what are the options. You have what the nurse first what she has to do. Okay. So first is what you will do if you realize there is a hemolytic reaction is taking place in a patient. Immediately what you do? You have to stop the infusion. Okay, that's the option number 3. Stop the infusion. That's the correct option. First one. This is the symptoms of feeling chilled, becoming short of breath, and having back pain could indicate an acute hemolytic reaction. This medical emergency requires swift action on the part of the nurse, including immediately discontinuing the infusion, flushing the IV site, and saving the unit of blood is questioned for testing. So some institution they keep all that tubings and the bag and everything and sent for blood to the blood bank for testing. Okay, if that's a question whether they want to do it or not, but stopping is the right thing you have to do. Okay, then treating the symptom of a reaction will not resolve the issue of allergic reaction to the treatment. Then just slowing the infusion will not solve. Okay, so slowing one or painkiller, nothing else is going to help. You have to stop first. Okay, so that's it. The next question, nurse received a report on a client with a right total knee arthroplasty who developed methicillin-resistant Staphylococcus aureus, MRSA, in the surgical incision. So, knee arthroplasty, MRSA positive infusion surgical site. Okay, the incision was cultured and showed sensitivity to vancomycin. So, patient is sensitive to vancomycin. So, here what you are going to give the third dose. Okay, so you did BU and blood work is done, BU and done, that is 14 mg per deciliter. Then creatinine is drawn, that's the result is 0.9 mg per deciliter. Intake and output are balanced. Now what you have to do is before giving to the next dose of vancomycin, you have to do a blood draw to know the true and the peak level of vancomycin. So when the nurse has to do that. Okay, first draw a true 30 minutes prior to dose and draw a peak 60 minutes after infusion. Okay, now draw a peak 30 minutes prior to dose and draw a true 60 minutes after infusion. Hold the dose of vancomycin and notify the physician of BUN and creatinine level. Give the dose of vancomycin as ordered and draw the peak and true with the other evening labs. So here, peak means when you get the peak. Peak you will be when you given medication and after some time you will get the peak level. Okay, so you will not get a peak, that you keep it in your mind. You will not get a peak level just before giving 30 minutes. Do you think? Because before giving 30 minutes it's almost the effect of that drug is gone. That's why you are going to give the next one. So if you think in that way, easily you can eliminate all the options except one. Draw a true 30 minutes prior to dose and draw a peak of 60 minutes after the infusion. Okay, so rest all easily you can eliminate the options. Then the other is like BUN level, creatinine level, everything is normal. BUN was 14 and creatinine was 0.9. This was all normal level. Okay, so that is it, how you have to eliminate your answers. Sometimes you use your common sense, it comes out correct. Okay, but that's it. Thanks for watching, guys. Okay, see you with some other video soon. Bye.